In this video, I'm going to talk about the results from our recent survey of the Pleasant Ridge community in Cincinnati on COVID-19 social distancing behaviors. This is Phil Smith, and right off the bat, I want to thank my colleague Paul Branscombe from Miami University, who is co-leading this project with me. We are professors at Miami University, but I do need to say that what we are presenting in this video is not on behalf of Miami University. So I'm going to start off by talking about the survey, tell you a little bit about the survey, then I'll get into the survey results, and then our recommendations based on the survey results, and last, what are next steps for this project. First off, why do we do the survey? So we wanted to better understand what Pleasant Ridge community members think about social distancing in this time of our global coronavirus pandemic, and with a goal of, as a community, knowing the best ways to encourage social distancing among our community members. So we asked people to take this survey on Facebook, and we had 84 community members fill out the survey, take 10-15 minutes to complete the survey, which is awesome. We would have liked to have gotten a little bit more, but we ended up cutting our survey short because the governor of Ohio decided to issue a stay-in-place order during the middle of when people were filling out the survey, and so we thought that could have major implications for people's answers, and so we decided to cut the survey off at that point so that our results were most interpretable. So who ended up taking the survey? Of these 84 community members, about 80% were female, about 98% identified as white, and the ages ranged from 18 to 83, and the average age was about 43. And a little bit later on in this video presentation, I'm going to talk about what this means for our recommendations for the community. In the survey, we were focusing on people's intentions to practice 3 different social distancing behaviors for the next 2 weeks. So we were asking people, for example, did they intend to, as much as possible, maintain 6 feet distance from others outside their home for the next 2 weeks? As much as possible, do they intend to avoid places where at least 10 people are congregating for the next 2 weeks? And as much as possible, are community members intending to stay home for the next 2 weeks? And for all of these, we provided definitions that were reasonable. So for example, when we say stay at home as much as possible, like this doesn't include going for walks, right? This doesn't include going to outdoor spaces where people are not congregating. This doesn't include getting groceries or going to healthcare professionals. So we're talking about as much as possible staying home, maintaining 6 feet distance, and avoiding places where people congregate. We also asked about attitudes about these 3 behaviors. So do community members think these behaviors are unpleasant or frustrating? Do community members think these behaviors are important or valuable to perform? Then we asked community members about their beliefs about other people. So, for example, do community members believe that others will be practicing these social distancing behaviors? And then do community members believe that others who are important to them or who they're close to thinks they should practice these behaviors? So for example, my mom is important to me. Does my mom think I should be practicing these behaviors? The last thing we asked about were beliefs about people's control over these behaviors. So do community members believe that they have the ability to perform social distancing behaviors? And do community members believe they have a choice about performing these behaviors? What we did with all of this information is we summarized community members' responses to get a sense of what people are thinking and feeling. And then we looked at which beliefs, which attitudes, which beliefs about others, which beliefs about their control over these behaviors, which beliefs are most closely related to community members' intentions to actually practice these behaviors. first I'm going to summarize what community members who took the survey are thinking and feeling. First, for intentions to practice this social distancing behavior of keeping 6 feet away from people outside the home, this little visual shows on the one side, the one extreme of definitely not intending to do this, on the other extreme definitely intending to do this, and neutral in the middle. And as you can see, on average, our community members who took this survey are really close to the far end of intending to practice this behavior for the next 2 weeks. To put this another way, fewer than 5%, so fewer than 1 out of 20 respondents responded somewhere in the range of like not intending to do this or neutral about staying 6 feet. So again, people are mostly really intending to practice this social distancing behavior in our community. One additional thing I think is really important to mention is that there was a little bit of a difference by age group for this particular intention, which was that younger respondents tended to be less likely to intend to practice this behavior compared to older respondents. Intentions on average were also pretty high for avoiding places where people congregate. And again, this is emphasized by the fact that fewer than 1 in 20 respondents, fewer than 5%, responded somewhere in this range of do not intend to neutral for avoiding places where at least 10 people are congregating. The last behavior we asked about were people's intentions to stay home as much as possible. And you might notice just by looking at this that that arrow is a little bit farther left than the other 2 behaviors. So on average, people still intended on average to stay at home as much as possible. However, those intentions were clearly less strong than intentions to practice safe distancing, 6 feet distancing, and to avoid places where at least 10 people are congregating. And you'll see that number on the left there over the bracket is a little bit higher for this one. So about 1 in 5 people who took the survey responded somewhere in the range of not intending to stay at home as much as possible or feeling neutral about this. Just to quickly summarize what I've covered so far, on average, people are intending and planning to practice social distancing behaviors. But people are least likely to be planning to stay at home as much as possible. And just a reminder, this does not include going for walks, getting groceries, getting medical care. So this does not include some of this really necessary stuff. This is really just generally, are you going to stay home as much as you can? And then again, just mentioning that for keeping 6 distance, younger respondents were less likely to intend to practice that behavior than older respondents. In this slide, I'm going to quickly summarize across all the different beliefs that we asked about. So I think, as to be expected, community members find social distancing on average to be unpleasant and frustrating. I think we can understand why that's the case. Then also on average, community members tended to believe social distancing is important, that other people are practicing social distancing, that people important to them think they should be social distancing, that they're able to practice social distancing, and that they're in control of whether they practice social distancing. So for at least the people who responded to this survey, these are all positive signs that on average people are feeling these things. So the next thing we looked at was which beliefs actually relate to people's intentions to practice social distancing. And the results were a little bit different across the behaviors with some similarities too. So for maintaining 6 feet, people's intentions tended to be higher the more strongly they felt like it was something important for them to do. Intentions tended to be higher the more likely it was that they thought that people who are close to them think it's important that they should do it. And the more likely they were to respond that they're able to do it, the more likely they intended to do it. Community members, for avoiding places where people congregate, were more likely to intend to do this if they thought that other people are doing it. And that was particularly true for younger respondents. And then also, again, the feeling that people are able to avoid places where people congregate was strongly related to intentions to do so. And then finally, for staying home, the results were kind of the same as maintaining 6 feet. So people are more likely to report they intended to stay home in our community if they felt like it was an important thing to do, if they felt like people who are important to them or close to them think they should do it, and if they felt like they are able to do it. One thing I want to point out is that across behaviors, the belief that our community members are able to practice social distancing was most strongly and most consistently related to their intentions to actually do it. The last thing about the survey results that I want to briefly talk about is which beliefs did not relate to people's intentions. So for now, the extent to which community members felt like social distancing is unpleasant or frustrating didn't really have a strong relationship to their intentions to practice social distancing. And then second here is that beliefs about other people's actions didn't have a strong relationship to intention. So the extent to which community members believe other people are practicing social distancing didn't have a strong relationship to whether they intended to practice social distancing themselves, with one interesting exception, which was that for young people, their intention to avoid places where people congregate was strongly impacted by their belief that other people like them are also doing this. And then lastly, beliefs about whether social distancing is a choice didn't have strong implications for people's intentions. Based on the results of the survey, we have 7, I think, pretty simple recommendations for the Pleasant Ridge community. The first recommendation is just how important it is to continue focusing on functional support for people practicing social distancing. And this includes as a community, this includes as family members, neighbors, friends. The more that people in our community can practice social distancing, the more that they will. The second recommendation is to, as much as you can, tell people that you're close with that it's important to you that they practice social distancing. And this one's important because this can't really come from a community at large. This can't come from a health department or the CDC. This is one that is really important to take advantage of through your direct social ties with each other. The third recommendation is how important it is to continue communicating accurate information from official sources about why it's important to engage in social distancing and communicating these messages as clearly as possible. The fourth recommendation is for focusing on younger people and how it's especially important to communicate to younger people that other people like them are practicing social distancing and that it's important that they practice social distancing for various reasons, including not getting sick themselves, not getting other people sick, and then especially communicating to younger people that you're close with, so family members, etc., that it's important to you that they practice social distancing and why. Although people's feelings about social distancing being unpleasant and frustrating at this point wasn't really strongly related to their intentions, as time goes by and people get more and more sick of doing this, that could change. So as a community, this recommendation is let's continue to do all the awesome things that people are doing to try to make social distancing less miserable for each other. The next recommendation is to make sure that community efforts, community engagement, has representation across social groups in our community. So the people who responded to this survey tended to be our more wealthy white community members. And so figuring out how bidirectional communication can happen with less well-represented groups in our community is really important to make sure that we're coming together as an entire community and not necessarily just people who are most likely to follow the Facebook page or engage with the Facebook page. The last recommendation is that compared to the social distancing behaviors of keeping 6 feet distance, of avoiding places where at least 10 people are congregating, people may need extra support and encouragement around staying home as much as possible, which we know is a really important part of our community response and our ability to prevent spread of coronavirus in our community. The last thing I'll quickly talk about is what's next for this particular project. How can we continue to help inform the Pleasant Ridge community efforts in relation to coronavirus? So we're going to be contacting people who took the first survey to fill up a follow-up survey that asks a little bit more detail about their beliefs and intentions. And we already wrote a publication that we're ready to send out for peer review based on our research findings. And then lastly, we're talking about how we can potentially use this really rapid, straightforward, simple process to work with other communities, local communities, to help inform their efforts as well. So thank you very much for watching this video, for everything that you're doing already, for those who took the 10 to 15 minutes to take our survey, that you were willing to put in that time to give us useful information that can help protect our community, that can help limit the spread of coronavirus in our community and potentially even save lives. So we really, really appreciate it. And take care and stay tuned.